Florida is probably one of the most highly regulated states for healthcare facilities. These include hospitals, nursing homes, and surgical centers. The facilities that have patients that are basically sedated, under narcosis, or are being provided with medication by skilled nursing help, are required by the state to be licensed. To obtain this license, they have to construct their facilities in accordance with the codes and regulations that are provided by the Agency of Healthcare Administration. This process requires that a facility that requires to either build new or renovate their facility has to go through this procedure or steps, which include providing drawings at schematic stage, at planning stage, and at final stage. And once these plans have been approved, they are allowed to start construction to build their facilities. And again, the state will require that these facilities be inspected at stage 40%, which means the walls are starting to go up, the foundations have been poured, and probably the roof is on. Once the walls have been constructed but not covered up yet, the state will again come and inspect, which they call an 80% inspection, and will review the facility with an architect, an electrical, and a mechanical engineer to make sure that the walls are constructed correctly to code, that the electrical infrastructure is correctly built, and that the plumbing, air conditioning systems are, and especially the fire alarm as well as the medical gases, are again installed according to code. If they get approved and they make all the corrections with all the notes, then the state will provide the final inspection at 100% when all the equipment, everything is up and running. Everything has to work correctly, especially in emergencies. This whole concept of a hospital design or a healthcare design is based on defending in place, which means a patient that is under narcosis cannot defend, is not conscious, cannot defend himself. They cannot organize exiting out of the building if there is a fire or smoke. And so these things are all very much regulated in the sense that smoke is probably the largest killer or hazard in a hospital. It travels very fast. It finds any little opening anywhere and will continue traveling as fast as it can. Therefore, the design of a building, which is done by a highly specialized architect, engineer, or engineers that are electrical, mechanical, plumbing, fire protection, they will design the buildings to make these defense systems work. To do this, the concept of defend in place in a hospital is achieved by compartmentalizing the building. Think of it as a ship. Ship has compartments. If it springs a leak, they shut the compartments and the leak is contained in a certain location. It's the same concept with a hospital or a nursing home. If there is a fire or smoke or any kind of major emergency, they will isolate that area and they can move the patients out horizontally but not vertically. You cannot carry patients down the staircase in beds and attach to IVs or any kind of other equipment. Therefore, these facilities have to be very conscious of how these things are designed. To assist the architect, the American Institute of Architects has developed guidelines for design and construction of hospitals and healthcare facilities. Since 1947, the American Institute of Architects guidelines have set a minimum standard for the American healthcare facility design. Today, these design performance-oriented requirements give healthcare providers and design professionals guidance on good practice and emerging trends. JCAHO, many federal agencies and authorities in 42 states use the guidelines, either as a code are a reference standard when reviewing, approving, and financing plans, surveying, licensing, certifying, or accrediting complete facilities, or developing their own codes. The AA Guidelines for Design and Construction of Hospitals and Healthcare Facilities reorganizes and renumbers content according to facility types. Standardized language, use of information categories, and introduce color to help use quicker find the information they need. Responding to public input, the Multidisciplinary Health Guideline Revision Committee of the Facility Guidelines Institute made significant content updates. Part 1, general applicable to all healthcare facilities. Expansion of the environment of care chapter, including detailed functional program requirements and an appendix on green design, new materials, and infection control risk assessment, ICRA, and infection control risk mitigation recommendations, a chapter on the common requirements for all healthcare facility types. Part 2, hospitals. Single bedrooms as the minimum standard for typical nursing units in general hospitals. Revised bed clearances and new bedside documentation areas in critical care units. New sections on intermediate care units in general hospitals, observation units, emergency departments, freestanding emergency facilities, and in-hospital skilled nursing units. Revised text for decontamination areas and appendix language on surge capacity in emergency departments. Revised section on in-hospital psychiatric nursing units. New chapters on small inpatient primary care hospitals. Ambulatory care facilities. A chapter of common element for outpatient facilities. Revised chapters on freestanding surgical facilities, birthing centers, and primary care outpatient facilities. New chapters on urgent care facilities, office surgical facilities, gastrointestinal endoscopy facilities, renal dialysis centers, and psychiatric outpatient centers. Other healthcare facilities. The following pictures and slides you will see are my work that I've worked on many hospitals and healthcare facilities over the past 25 years in Florida. These all show the different designs, the different approach, the different solutions to situations that were specific to the healthcare facility. It is somewhat difficult to explain every detail of these slides on this video. As you can see, we are very conscious of what we call buildings that are designed to cure, and that means that patients feel very comfortable, relaxed, and can feel at home rather than being in an institution. This is very important for the patient as well as the families. Circulation is of very high importance to us. You want to make sure that you don't have either the staff or the patients travel forever to get to their destination. And again, therefore, there are several solutions here that we've come up with that we feel have achieved and accomplished these goals. We thank you so much for giving us this opportunity to show you this video.